Good evening, everyone. Again, my name is Doug Kress. I am the Director of Health and Human Services for the City of Somerville. I want to thank you for taking the time out of your schedule today to join us on our third town hall meeting regarding our supervised consumption site exploratory options that we have and moving forward with bringing a site here to Somerville. Tonight, we're excited to have our conversation about community and businesses. And I'm thrilled to have several different panelists with us tonight. Tonight, we will have Mayor Joe Curtatone with us, who's going to talk a little bit about why Somerville and what impact is this going to have on our community. We're very lucky to have a couple of our representatives who have really been involved with supervised injection facilities and supervised consumption sites from our Canadian neighbors. We have Melanie Renaud, who is a business owner and a business person who actually has one that's fairly close to a couple of the supervised consumption sites in Canada, is going to talk about her experience with that. We're also lucky to have Michael Pittsford here, who is the attaché or government affairs for the Quebec and is a representative who actually lives here in Boston with us and works with the government up there and does our public affairs or does their government affairs. Once again, we have TJ Thompson, one of our harm reduction specialists in the area. We're thrilled to have him join our meeting as always and can really answer questions around harm reduction. Finally, I want to thank Megan Ackerman and Dan Moore, who are also helping us with this town hall tonight. Megan will be assisting us with our Q&As. So what I want to remind everybody about is that at the bottom of your screen, you will have a little button that says Q&A on it. Please use that to ask your questions, and we will get to those both throughout the presentation tonight, but also at the end of the meeting, we'll be able to answer those. So with that, I'm going to ask the mayor to kick us off and really talk a little bit more about, why Somerville and what impact does he see this will have on our community as well as our business community. Mayor.
Thanks. Thank you, Doug. And thank you everyone who tuned in this evening. We'll be watching this later, for being engaged, for asking questions, and for doing two things we've asked you to do from the very beginning. It's not to make a decision or believe anything we say up the bat, but to read the information, look at the data, and have an open mind and an open heart. The only impact we see is positive in our community, and the data, as you hear, and the information and the statistics all point that out. Positive to keeping people healthy, safe, and alive. And when we have a healthy community, we have a happy community, a productive community. Positive in the way that when people truly believe a community allows authentically people to live a healthy, safe, and sustainable life there, it means positive impacts for our neighborhoods and our local economy. And all the data and all the information you'll hear, we want to hear your questions. We'll point to that. This information about it's a detriment to business, or drive business away, or it increases crime, that is all proven to not be true, not be accurate, but we ask you to not just take our word for it, to look at the information, ask questions of it, because that is undoubtedly not the case. What we know and why Somerville is we are not immune to the scourge of overdose deaths and addiction. It is a health crisis. And I can think of no greater responsibility as a civil and compassionate society than to make sure we do everything like we are during the pandemic to keep our friends and neighbors and our fellow residents and citizens safe. For far too long in this nation, we've had a silent, incremental approach to the overdose and addiction crisis. And we seem to take homage and pride in Massachusetts, for example, that when we say, well, we didn't have more than 2,000 deaths as a result of overdose this year, we had 1,800, and that's good news. Now, that's still awful news. There was still thousands of lives we could have saved every year with proven health methods that reduce harm and risk. For full disclosure, if you haven't heard me say this before, I was on the opposite side of this argument very explicitly. And I have this addiction in my family. I seemed counterintuitive to me. How could this help? Doesn't this drive addiction? But what drove me were the facts, the data, the science, and the results and proven methods in other parts of, not far from us in Canada, where we've seen in areas and neighborhoods and districts where they've had an implementation strategy, a 30+ 35% plus decrease in overdose deaths, and as great of increase in people seeking help for their addiction. So that's why I say, why Somerville? And I'd say also, why not every municipality in every state in this nation? We don't need a piloting strategy. We need an implementation strategy. We have supervised consumption sites happening right now. They're the stories we hear, for the calls we get from parents saying, I am watching, I bought Narcan, my son or daughter or brother or loved one take their narcotics they're addicted to, or their substance they're addicted to, just so I'm there to save them. We've heard from those in the addiction community who said to us, we don't want to die. We want to be safe. And this is a health crisis. It is, we need to be treating this like a disease and crisis that it is, and destigmatizing people who didn't choose to become addicted. I don't know anyone when they're in kindergarten or first grade, when your teacher asked you, what do you want to be when you grow up? And they said, I think I'm going to be an addict. These are members of our community, like me, the loved ones. So many of you, I'm sure, are connected or know someone. I've had many friends throughout my life who have battled addiction, have succumbed to it, did everything they could. And so why Somerville, like I would say anyone else? It's our collective responsibility, not to abdicate that responsibility, do everything we can to reduce harm and risk and keep everyone safe. When we do that, we're happy, we're healthy, we're productive, we're more prosperous. And when we live up to those values, people pay attention. We've done that all along. So I thank you for coming out tonight. I look forward to your questions. Please ask your questions. We want to answer them. We want you to have all the information. And I ask you once again, please keep an open mind and an open heart. I know you will. Thanks, Doug.
Thank you, Mayor. I really appreciate everything you've done for our community, especially around this topic itself, and being a leader to move this forward. I remember several years ago, I think it was about 3 years ago, when I first brought this to your attention and really kind of looked at this. And we sat in your office and had that conversation with some of our community members and our residents about this particular topic. And we were able to move it forward. And you were able to step up to the plate and really talk about it and have been an advocate for it. So I do thank you for that. Next, I want to actually invite Melanie to talk a little bit about some of her experiences. As I said when we were introducing everybody today, Melanie is a business owner and a business person who has personal stories about this, because she is close to one of the sites in Canada and is able to give us some information about what impact it has on her business, and the community around her area. So Melanie, thank you for joining us tonight. I know you're up in Canada, and I think you're probably experiencing some of the same heat that we are. So thank you for taking the time really to join us tonight and share some of your experiences. Melanie, I'm going to turn this over to you.
Okay. Thank you, Doug. Thank you. I'm really happy to be here today with you. I think it's really important to talk about this. The center has been really a good, positive addition to the neighborhood. It was really good for the cafe. The cafe opened in September 2013, and the supervised injection site opened in November 2017. So we had 4 years before, and then since then it's been almost 4 years already since it opened. So I can tell you that it has had a very positive impact on the business. Prior to the center opening, we had, on a semi-regular basis, maybe at least once a month, people shooting up in our bathroom at the cafe. It was always a really difficult position to be in, to kind of have to judge the person that's asking to go to the bathroom. But we knew that it was also sometimes a reality of what would happen in the bathroom. Since the center has opened in 2017, we've never had that issue again in the bathroom at the cafe. So that was already one mega positive change. The center where they opened the injection site is a center that already existed in the neighborhood to help people in difficulty or in the streets, and they added the injection center next to it. So since we've had them next door, they were literally like 2 doors down. They're really, really close to our cafe. Since they've been open, it's been also a really nice resource center. Like if we have people coming in that are looking for like some food or a coffee, they also have a day center that's available. So they can also just go and hang out somewhere, which is really nice, especially in the winter time when it's way tougher out in the streets. So since we've had the center opening, there was concern at the beginning before the center opened, definitely in the neighborhood, especially from some parents, because there is a school close by and a few centers where like kids go a lot. So there was concern from the parents about how it would impact to have the site there. Like people were thinking maybe there'll be like more, don't really like using this term, but like sketchy people hanging around the area. So that was a concern for the parents. The people from the center did meet with the parents as big discussions, and it's all been done in a really safe way. What's also been really good is they've have teams that go walk around the neighborhood and pick up any syringes or anything that might be hanging around that could be harmful to the kids. So they have a lot of resources. It's not just the injection center, but it has a lot of like different things that fall from that. So the worries since then, there hasn't been any more worries from the schools. It's kind of making the people more concentrated around the injection site. So sometimes in the morning, there'll be like some people hanging around outside waiting for it to open. It is a daytime center that we have next to the cafe. I know some others are all night long or nighttime, but ours is during the daytime. And there is, so I don't know how many people they have going on a daily basis, but the people going there, it doesn't affect the cafe. I mean, they'll rarely like come into the cafe. They won't come and, for example, like ask for money or things like that. Which before we had way more like people coming in and trying to either ask for some help or different things like that, which was always a bit of an awkward situation because you don't want to obviously refuse to help someone, but at the same time, you've got the clients in the cafe, sometimes with families and things like that. So you want to make sure also that everybody is in a safe environment. But since it's open, it's seriously been a really good thing. And what we're doing also very soon is doing a training, a workshop with the employees that's done through the injection site to learn techniques and tips on how to discuss with people that might be high or that might be in a certain situation that they're not doing really well. So that's a free workshop that's given also by the injection site, which I find is a really nice bonus for all the businesses around in the neighborhood. What else can I tell you? We also had, before they opened, they had an open house so they could show us what it looks like. So all the businesses were invited to go and take a look at the center. And they've been really, really good at being in touch with all the businesses as well to discuss if there was any issues or anything like that. So they're really also involved in the community. So personally, I can say that it's really been positive. And a few times where we might have had some issues with people that came in and we tried to ask them to leave nicely and it wouldn't work. Well, sometimes we just went next door and got someone who's trained in that department basically to come and help us, So that's also been a very positive aspect to have that resource as well. Closer to us than it might have been in the past. So that's also been quite a positive aspect to it. I think that kind of covers my presentation about it, but if you do have questions, please feel free. I'd be happy to answer them.
Great. Thank you, Melanie, for providing us, some insight that you've had in your own business and what it's like in there. And I think one of the things that I kind of pulled out of that is that it's nice to have additional resources in there not just for your clients or for the residents in the area, and also the business, the people who come to your business, but also for your staff to help them kind of think differently about, mental health and substance use, and that how a lot of times those are connected, and you need some of those additional supports, which I think is really, really helpful for a lot of people. So thank you for doing that, and thank you for the work. I'm going to turn this over to Michael. Michael, if you could just talk a little bit about, what you are doing up in Montreal, to really kind of look at this, and as you guys have been a leader, I know many places have stopped up to visit you and visit the different sites. What are the other things you all are doing up there that we could maybe learn from as we move forward with our plans here?
Yeah, absolutely. Thank you for that, Doug. And it's a pleasure to see Mayor Curtatone on the line as well. Doug had introduced me. I'm Michael Pittsford. I work with the Quebec government here in Boston. So we represent the Quebec provincial government in the 6 New England states. And one of our roles really as a neighbor, we border 3 US states, or 4 US states, sorry, 3 of them are here in New England. We only border 2 Canadian provinces. So working with you and working with the city of Somerville, working with the states here in New England is part of our daily existence. It's part of being a good neighbor. We in Quebec have had safe injection sites in the city of Montreal, where Melanie is based, since 2017. Currently, there are 3 fixed physical locations where you can visit a safe injection services. And there's 1 mobile unit as well. And so those sites have been in place since 2017. And I can confirm what Melanie has shared, what the mayor had mentioned, and what Doug has shared as well. These sites have saved lives of the people in our province, and they have saved lives for people across Canada as well. And the philosophy behind that for us is what we call harm reduction. We were already, since the 1980s in Quebec, doing needle exchange programs, as an example, and meeting with one of our experts who wrote the policy for the province, where he often cited this as an example, is you have somebody and you share a needle with them, but then you're putting your head in the sand as to what they do next. And for him and for our Ministry of Health, offering safe injection and safe consumption services was part of our health strategy. It's part of keeping our people healthy, part of keeping our people safe, in the same way that a needle exchange program is. And so that's where that growth and push for safe injection service in Montreal first began. It was this desire to grow the full suite of services that are offered to some of the most vulnerable people in our population. What I can share as well, and Melanie mentioned this, and Doug, you recapped this quite well, is that the safe consumption services are not just a resource for drug users in the community. They're a resource for business owners. They're a resource for all of the residents of the community where they open up. And I'm happy to connect with those and with the city of Somerville after this, to share some of our other experience and some of the data we've collected. I know, as a resident of Boston myself, the mass and CAS issue is currently very much in the news. And one of the big questions that we get all the time is, what does this result in a concentration of services? Do people travel to use these? And the experience in Montreal is no. There's a very small limit to what people are willing to travel to do in our experience. And typically these services in the neighborhoods where they are located are used by the people who are already in that neighborhood primarily. And the mobile unit is used to serve other areas of the city that may not be served by a fixed location. And I'll just close on this briefly in terms of how this works on the federal level in Canada versus how it works on the provincial level. And I know this is a city that's hoping to open it up, and so I won't speak for Massachusetts, but what happened in Canada, the first sites opened in Vancouver in the province of British Columbia. Montreal was the second city in Canada to have safe injection services in 2017. What the federal government has done in Canada is grant an exemption to these services for the use of otherwise illegal substances at these locations, but they do not otherwise have involvement in regulating the services or providing funding. It's all done at the provincial level. And during the pandemic, we've actually seen the opening, because there has been an epidemic of opioid use going alongside the COVID-19 pandemic. And so there have been some services that have opened during the pandemic. granted that exemption from the provincial level or from the federal level, and then given the funding needed to open from the provincial government. And so that's something that is currently being done by the provincial Ministry of Health, and a new site opened last year in Quebec City, which is the capital of the province and is a smaller city than Montreal. It's got a metro population of about 2 million. And these services are actually open all across Canada now. So it's not just in Quebec or British Columbia. And I will just share, I don't know if Melanie has visited Somerville, but maybe I'll just close on this. But the neighborhood where her cafe is based actually reminds me a lot of Davis Square. I have to be honest, I visited quite a bit. I don't know what the location is for, clans in Somerville, but, the neighborhood is quite similar in that sense, and very similar cultural vibes, and a really great neighborhood of Montreal that, as the visitors who we took to visit these sites could attest, you would never know that the site is there. And something that our director of harm reduction policy often mentions is that there's a bar, like a nightclub sort of thing, right near one of the services in Montreal, and the police are called far more frequently for complaints in the neighborhood to that bar than they have ever been to the safe injection site that's located right next door. And I think that story speaks volumes. And I've heard more than just from Melanie about business owners that are supportive of these services having opened up in their city. So I won't be able to stay on for the Q&A, but Doug does have my contact information, and we will do our best, as I said, as neighbors, to be supportive of this process here in New England and provide what we've learned. We have not opened them because we're somehow better or more advanced or anything like that. We face the same crisis that folks in Massachusetts have faced, that folks in Somerville have faced, and we found a possible solution to this. And so we're happy to share any way we can help to our neighbors and best practices on the next steps in this process. So thank you all, and thank you for having us for this, and thank you for this work as well.
Thank you, Michael, and thank you for the time. And you did express that you have to hop off a little early. Good luck with your journey. I hope everything goes well for you. And thank you for taking the time and sharing some of your experiences with us and the knowledge that you have. And we obviously will be following up and talking. So thank you for joining us. I do want to go one really quick step before we move forward with some Q&A and be able to kind of move forward on a couple things. I think one of the biggest questions a lot of people have is, what are these things going to look like? What will it be? So I actually have, did a little bit of research and pulled up a couple of sites so people can see that. I am going to share my screen so you can take a look at this. And I hope everybody's able to see some of this information. And I'm just going to show a quick slides that I put together so that you can kind of take a look at what these look like. And these are simply views of supervised consumption sites. Most of them are up in our neighboring country, but I do have a couple from other places. I don't have a lot of slides because I think what you're going to see is that they look like neighborhoods. They look like a building and what they will look like. But one thing I want to remind us is that what is a supervised consumption site? And they're also referred to as a supervised injection facility, drug consumption room, or an overdose prevention site. But these are hygienic environments where individuals can bring pre-obtained drugs to use under the supervision of a healthcare professional, somebody who is trained that can respond with oxygen, naloxone, or Narcan, as many of us know about this, in the event of an overdose to prevent that overdose. They also provide a variety of other support services tied to these types of services. Melanie mentioned a few of those during her presentation, but we know that one of the things that we want to do is we want to make sure that a facility here in Somerville or any facility that were to be open, that it's something that individuals who want to consume will use this site. We don't just want to build it without their input. We do not want to create this without people in our neighborhoods being part of that decision and that process to really understand the idea of this. I want to remind us that the first sanctioned SCS supervised consumption site was established in Switzerland back in 1986. And there are now over 120 sites located in 11 different countries. While they operate under a range of models, they really are part of a larger continuum of care for people who use drugs and seek to connect with individuals who may or may not be readily engaged with other existing healthcare sites and other healthcare settings. So this is an important piece to really make sure that there are those connections. The next several slides are really about different sites that are out there. As Michael mentioned, there are some that are mobile. Here's a view of what a mobile site might look like. And this one happens to be in rural British Columbia. We have the one in Toronto for the mobile supervised consumption services that are out and about that Michael has briefly talked about. As you can see, they don't have to be necessarily that large in order for people to utilize them and see what they look like, see what they feel like. Insight is one of the most popular ones that we hear about. Now, this is kind of a close-up shot, but as you can see, it's a regular street. There's people who are walking down the street in a regular conversation just along the street systems that they are. I think that's an important thing that we think about, that these are fit into communities where people are and where people live. We also have other sites, and this one happens to be in Lethbridge, that very benign looking building where you would have something like this and a variety of people might utilize. Another option, such as in Geneva, Switzerland, sometimes they can be very creative and really look out a little bit different, really being able to do this. This is while they were still doing the construction of one in Geneva, but as you can see, it's really a unique, kind of stands out a little bit. But you know, if you've been over into Switzerland, you know that there's a variety of things that they often are famous for, and some of their architectural is a little bit more boxy, but it's something that is kind of an interesting look. I also want to make sure that people understand what they will look like on the inside. As we've talked about in the previous town hall meetings, one of the things that we want to look at is really when we talk about a supervised consumption site and making sure that it's a clean environment, here's what it would look like on the interior. This is just one example that we have. And here's another where you see you have the reception desk where they may receive some of the supplies that they would need in order to do the injections themselves. And as a reminder, these are clean and sterile locations so that we can prevent the spread of additional diseases. I think is an important piece that we always want to think about, as well as they're being observed so that if they are beginning to overdose, a response can happen immediately. Here's another look of what we might want to see or what we might see in a site. And again, these are just from existing locations. This does not mean this is what ours will look like, because as you can see, there's a variety of opportunities for us to look at and a variety of opportunities for us to choose from. But these are general observation areas where you can then look. Again, this is tied to the one in Switzerland. I think you can probably see that their color scheme has kind of continued to look through and follow through when you look at that. Finally, as we have talked about in previous town hall meetings, and as we think about this, this is an interior layout example. And again, this is only an example for us to think about and give our audience a little bit of an understanding of, so what all might this look like? And this isn't just one big open room where there's just injecting that happens. As a reminder, we want to make sure that people are able to connect to a variety of other services. So we have consulting areas, we have the monitoring space, we have the injecting space where we're able to do that. There is a variety of consulting opportunities that we have, possibly even small group areas. There's also an opportunity for aftercare if there's additional support services or if they need to relax for a little bit before they move back out onto the streets. And go back onto their daily activities of what they might be doing. So keep in mind that there's a variety of opportunities that we can look at. But as I said earlier in this, we want to make sure that the services and the look and the layout is something that users would be interested in coming to, so that this is a place where they would actually visit. We don't want to build something that would just not be used. So we want to make sure that we're engaging our communities when we're doing this. Additionally, when you look at this, I just want to kind of point out again, the United States seems to be behind the ball. When we look at this, here are the locations of drug consumption facilities throughout Europe, and this was in 2017. Additional sites have opened since that time, And you can see where the numbers are, and it's across the area. Let's face it, if this was not a successful tool in harm reduction, would they have opened up this many? So we have to remind ourselves that we need to catch up. We need to look at this and make sure that we are moving forward in the right direction to support our community members. Lastly, we've all talked a little bit about a variety of things, and this we can certainly make available to individuals, and this will be available on our websites as well with the slides. Just some additional information of why supervised consumption facilities and supervised consumption services are an important piece of our community, and why it's an important harm reduction tool that we need to implement here in Somerville, as well as across the Commonwealth and across the US. Those are just a few examples of what we really do have in giving you some idea of what these types of facilities may look like if we were to move this forward. I know, TJ, you've been sitting there so quietly and everything. I'm not sure if you want to, which is unlike you to not jump in, but I do want to give you a chance if you want to add anything to any of the comments that people have said so far tonight, and then we can move into some of the questions and answer or questions that people have been posting.
I don't have much to say. I really enjoyed listening to the stories about being in a coffee shop next to one of these sites, because I think I talked to people a lot of times, and the first thing they bring up is like, everyone's worried about the honeypot effect. People are worried about possible behavior outside of places or attracting people, and you read these studies all the time, and you read them from Insight, you read them from all across the world, really, and every time it's like, things mellow out in the neighborhoods. It's less trash. It's a place where people can go and really focus on their safety and their health, their mental health, and get connected to something that might further them to keep going along that path. And I think that's the first thing we should always think about. I mean, if people are worried about people congregating. I was on a Facebook page the other day, and people were talking about Davis Square already, about how, there's a lot of disparaging comments about people and maybe their behavior or their congregations outside of the subway stop. And the thing is, like, one of my main arguments is like, well, if we build one of these facilities nearby to a place like that, and you're complaining right now about people being outside, people, misbehaving, if you will, or behaving there are people right now that have nowhere to go. And we open up a facility that is clean and safe for people. They will go inside. And if your main complaint right now is seeing people, like, I hate to say this, but like, you won't see them outside anymore, because they'll go inside, and inside they have access to so much more than they do when people are stuck outside on the sidewalk. It's just a thought I've had lately when I'm reading these comments. That is just one point I wanted to make.
Great, thank you, TJ. Megan, you've been monitoring some of the questions. I'm wondering if you could bring up some of those questions for us.
Yeah, let's get started. So first we have one about timing, which is, will the site open before Mayor Joe's term ends? As folks may know, Mayor Curtatone has decided not to run for another term, so he'll be leaving office in December or the beginning of January. So should we wait until after the election?
I'm going to say no. Whether it opens timely enough in the months that I'm here, I'm the mayor, sworn to uphold the public health, safety, and well-being and welfare of everyone in the city. So I'm clear, I fully intend to perform those duties through my term, and I hope everyone, this is not a political conversation, but as you're evaluating leadership here, I think this is an important question. People, where do they stand on harm reduction here? And I hope you keep that in mind. My job is to complete, and I'll complete my job through my term, which is be January 3rd, and fulfill that. Thank you.
Thank you, Mayor. Megan?
Great. So someone else was asking if there's been any sort of cost benefit analysis done.
Yeah, I can start with some of that. I think, as many people know, we've talked about this in previous town hall meetings, that there have been a number of cost analysis that have been done. In fact, one was done in Boston itself. And when you start looking at the cost benefit, Opening up a facility like this, far cheaper than all the expenses that we have currently, whether we talk about the number of overdoses, the police response that we have for overdoses, the hospital stays for anybody who starts to begin to overdose, all of the other work that we have to do in some of those areas. This is a far less expensive tool that we would have in our toolbox than any other. It is looking at saving lives, and that itself you cannot put a price on as well. Mayor, did you want to add anything to that? You look like you're on mute, sir.
Apologize. I would think I would get this down by now. You know, I answered the question, and I think everyone understands, even the person asked the questions, how do you put a value on that? I mean, however, there are monies we spend, we have to spend as a municipality in our healthcare system to respond to calls of overdoses and the lives they don't reach. And there are other kinds of liabilities that come along with that and the strain on our healthcare system. So we know in so many cases and so much research, the value and cost benefit of preventive measures of health, investing in harm reduction, and how that alleviates the strain on our healthcare system, alleviates the cost to all of us for healthcare in general and liabilities. And, I'll go back to what I said, and it's fact. And when you have a healthy, happy, productive society, the benefits are immeasurable to our economy, to our life quality. Like, people don't want to be part of a community that doesn't live up to its values, or that can't truly give people an opportunity to be safe. It's like any other public health or public safety crisis. It has to be at the center, along with the equity of what we do.
Thank you, Mayor. TJ, did you want to add anything to that? I know you've done some of the work and research on the cost analysis, cost benefits, and you've worked with Boston a little bit on some of those.
Yeah, I don't know if anyone actually mentioned this yet right now. I might have zoned out for a second, but it's $4 million Boston would be estimated to save, a city Boston size. And when you break it down to like what you're saving, like it's ambulance rides. Like, I actually recently took something off my credit, got something off my credit from an ambulance ride I took years ago. It was like $2,500, and now like that has to either go to Mass Health or like go to the city or whoever paid for that ambulance bill. Now, like, you have hundreds of these ambulance phone calls for overdose a year, like every year. So like, multiply that by the thousands of dollars right there. There's a lot of money saved for people, and it's money, but it's also health. Sometimes if people are using it in a situation where it's maybe not entirely clean, like a public bathroom, they have injuries like on their arms, they end up in the hospital, they can have things like endocarditis, they get soft tissue problems, and that costs millions of dollars all across the country every year of people just going in and being like, well, I could not use in a place that was sterile or clean, and now I have this really, really expensive injury where it just doesn't need to be happening. Like, when you walk into a safe consumption site, a supervised consumption site, like, everything in there is going to be clean. You're not going to, it takes away immediately a high risk of just like having bacteria on something or, touching things. Like, you're just in a clean area. People deserve like choices in their life, and they deserve dignity and cleanliness when they're using. But really the cost analysis like goes on and on, like having like, people pick up use syringes on the ground. It leads to cleaner neighborhoods. And so really, like, while people are saving money, people are also saving lives. So one death is too many, and this in something like this where people don't have to die. Soapbox down.
Thanks, TJ. And just to put some context to some of this, some of the data that we have in front of us that from January 1 of 2021 through 4/30/2021, right now, and this is not confirmed because we have to continue to obviously look at our reports and regular records and everything, suspected non-fatal opioid overdoses in Somerville, we had 41 of them. In that same time period, we suspect that there were 4 fatal overdoses of opioid overdoses in Somerville. That is a short period of time and the number of overdoses that we're talking about. And saving that amount of, think about the costs that are just associated with those, and that's our police response and any of the other healthcare systems that we may have to think about. Think about the cost that it also has on families and all of the other areas. I think it's an important piece to keep that in mind as well. Megan, did you want to have another?
Sure. I'm actually going to combine two questions that are relating to East Somerville. And before I do that, I do just want to give the added context that no site has been proposed for a supervised consumption site. So right now there is no one location that's being proposed as the home for this. So someone commented that East Somerville is the poorest, most disadvantaged area of Somerville with the most urban blight, doesn't have a redevelopment plan. And they're asking, should the SES not be in an area that is better equipped to deal with it? And then also related to, potentially citing one of these in East Somerville, how would we address the diversity and equity with regard to an SES in East Somerville? East Somerville has still not recovered from generations of discrimination. Only about 5% of people who answered our survey that was our researchers included with their needs assessment were from East Somerville. With there being schools in that neighborhood, how will the community be consulted in a fair and equitable way?
I can start off. First, I'd invite you to look at all the summer vision plans, the neighborhood growth plans. Development East Somerville is home to all the eastern part of the city, whether it's east on the most easterly or northern side down from Union Square, the greatest historic level of investment, not just in Somerville, probably on this side of the Metro Boston area. I hear you loud and clear because I grew up on Prospect Hill, but my time was on the east side. And I lived in East Somerville as well on the Avs. I know very well how that community has been. However, there's been historic planning, investment in infrastructure, growth, quality of life in schools across the whole city. We're only a city of 4.1 square miles. However, to that question, this has been a city of haves and have-nots. In fact, it's in that part of the city and other areas in Winter Hill or where our public housing is, where we see in COVID. If you drew a overlay of who lives in public housing, environmental justice zones, who has poorer health incomes, or who is poorer in general, those are the people in our community who are dying and getting sick at higher rates than the rest of us. So I would first say, thank you for the question. If you're interested, Megan, we can put up a link on all the plans because there's a tremendous amount of growth happening in the city. We're going to make sure the people in those communities have equitable access to that opportunity. That doesn't mean the same access more, because they've been left behind over the years to the jobs, the revenues, and the growth of that. So please look at that. However, let me just clarify one thing. The decision about where to base a site will be based on science and data and logic, not politics. It will not be as long as I'm here. If the science and data and all the information and research and the lessons learned from places we know done well says to have the greatest impact to save the most lives, it should be in this area. That was more than likely where it would be, not because one or a few people don't like it. Our job is to make sure you have all the information and data. In order to make ourselves very clear, it will not be based on politics or how many people want to complain, but what the data and science says. And Doug, I'll let you supplement that if you want.
Great, thank you, Mayor. And I would just kind of echo that. And some of the comments that Megan made earlier is that we haven't identified a location as of yet. That's going to be the next steps that we look at, as well as really giving the community an opportunity to have additional input when we have small community meetings. Hopefully those will be in person. We'll be able to move back into doing some of those a little bit closer in for everybody, giving people a chance to have that conversation and build on some of that. Our next steps are really to look at putting out a request for proposals for somebody to help us lead through those discussion points and really help us identify location, policies, procedures within a particular site itself, and getting that involvement of all the stakeholders that we're talking about, residents, community members, businesses, as well as potential clients within the site as well, our healthcare partners that we also have in our community, to see where we can do some of those bridging and build some of those partnerships that we have in that. I think that answers one of the questions that I saw pop up about where people are going to have a chance to do some of those comments and have public comment. These are going to be those locations as we move us forward within that. TJ, did you look like you wanted to hop in and say something when I was answering those questions?
Always. I wanted to address the racial disparity that comments that keep coming up that I keep hearing, and I don't think we've spent a lot of time talking about this publicly, about how when we the task force met for over a year. There were 4 subcommittees, and one of them was program and design. So we talked about the importance of what's going to go on in these places, and the number one thing that we talked about is, first off, making a welcoming, all-inclusive environment for people that can come in and feel safe. And we did notice when we received the data from the surveys that we did, it was an overwhelmingly white response. And people are like, well, who's being asked? And I'm like, so we do have to point out that, like, I mean, there is a reason you have people of color that don't respond to surveys about drugs or feel comfortable going into a place where the conversation about drugs. When you have like such a higher, horrifying representation of Black men and women in prison right now for small drug offenses. So I do want to bring it up that, like, there will be a plan cultivated to make people feel safe and reach out to people, but it's sometimes hard to get people to talk when they don't feel safe. So when we do open a safe consumption site, we have so many plans in place already to make this place feel safe. And once you create a safe environment, word spreads, and we are hoping to have that spread out so more people can come in and access these services that maybe otherwise would be frightened or is not trusting of it. So this is really, it weighed heavily on our minds in the planning for the past year. And I'd like it to be out there because I don't think we've talked about it enough.
Thank you, Stephen, for bringing that in and mentioning some of the task force work that we've been doing. I think that's an important piece because, you know, one of the things we always try and do is make sure that we're as inclusive as possible. It's something that we strive for. In any way that we can build on that, I think, is an important piece. Megan, I know that we are counting down on some of our time, but let's see if we can answer a few more of the questions that are out in the Q&A.
Sure. And this, I'm going to kind of combine a couple of questions on this one. Someone is asking if you could talk a little bit more about services that may be offered, including if there will be plans to help people test drugs to make sure that they know what they're using and they know what's in there. And then also, you know, if you could talk a little bit about, do these sites help reduce addiction or get people into treatment?
Great, thank you. That's a great question to ask, and that we can certainly begin to answer. But let me reiterate something that we've talked about throughout this is going to be a joint effort to really move us forward. We do know what we have heard both in the report. And Megan, can I ask you to post the link in the chat as well, so people can have access to the report on our website that we have done in the feasibility study that really does get into some of that detail. But there are a variety of support services that we talk about, whether that's around wound care, other types of health care, employment services, potentially other health services, counseling service, and of course, there's that access to treatment as well. That's one of the things that we have learned as well, is that this is also a pathway for some individuals to get into treatment when they're ready to enter into treatment. And I think that's one of the questions and one of the challenges that we always have with addiction, is that people need to make that decision on their own of when it's time to go into, when they're ready to move into that next phase and into that next step. But we want to make sure that they're alive in order to be able to do that. We also want to make sure that they're safe. One of the questions that you asked in this particular question is, would they be able to test the drug itself? Yes, that is an important piece of that, so that they know what they are actually going to be using when they do walk in, and make that decision about how they would use that and what the type of use that they would use whenever they move that forward. So I think those are important questions, and those are important answers that we will continue to develop. Again, we want to do this in partnership with our with potential clients and with our community members, our harm reduction specialists that are out there, as well as those who have been in, through treatment and are part of the treatment process as well, and our healthcare partners. We want to make sure that the services that we are providing are the ones that people need and will utilize. That way, people will use the services.
If we have time for another one, because I think this is a pretty quick one to answer. There have been some questions about funding, how the SES would be funded, who would be providing that funding.
Sure. We're looking at a variety of funding sources that we have available to us. I think a lot of people have also heard that, the state or the Commonwealth is looking at potentially having some opportunities to actually pilot a couple of these projects. That'd be great. Somerville can be shovel ready, be a wonderful opportunity for us to do that. We're not going to wait on that though. We are looking at a variety of funding opportunities that might be out there. We also know that there are a variety of foundation funds that we can possibly work with. We'll probably end up working with a nonprofit agency in order to accept some of those funds, because there are different legalities and different challenges that obviously we will face whenever we talk about looking for fundraising and doing some of that work. So we're building that infrastructure, we're building that platform as we move forward. And that's part of what the next contractor will help us identify and move forward. Mayor, did you want to add anything to that?
No, I think you covered pretty much anything I would have said. We're not going to wait. I just remind everyone, leading into COVID, approximately that we know of, 2,000 of our residents in Massachusetts succumb to overdose, substance overdose every year. And throughout COVID, the crisis has worsened. Because as you can imagine, the isolation and then on top of it, the mental trauma, stress, because of the uncertainty of the whole situation has not been good on anyone, but someone dealing with a disease as addiction, it's been more difficult. We can't wait. So, we are fully prepared on the legal side. We're fully prepared on how we know funding, and we'll disclose that to the public as we come final on that. But we're going to move deliberately, informatively, and share that with all of you. Be transparent.
Great, thank you. I'm looking at the time, and I see that we have hit that 7 o'clock mark. So I do want to thank everybody for taking the time to meet with us tonight and to join us in this conversation. Melanie, thank you for taking the time out of your schedule to be here and provide us with such great information and just giving us that lived experience. It's such an important piece that we want to hear and see. So thank you for taking the time today.
Can we, I'm sorry to interrupt, Rod. Can we remind people who maybe we didn't get to their questions or have follow-up, where they can get information, if there's a link we can put up, or who they can email and send us as many questions.
Yeah.
Keep asking questions. That's important.
I was just going to say, I was going to note, we do have a few questions we didn't get to. I've copied them down, so we have those. We will work on answers for those over the next couple of days and post them on somervillema.gov/SCS. That's also, that link is posted in the chat. You can find videos from previous town halls that we've had at that site, as well as a copy of the needs assessment report that our consultants did for us. So there's a lot of good information there.
Great, thank you. You jumped ahead, but that's all right. We're doing this as a team. But yes, thank you, Megan, for making that announcement. And again, it is at somervillema.gov/SCS. You'll find a variety of opportunities there. But I just wanted to two things: say thank you to Melanie, to TJ for your ongoing support and the work that you're doing in this. Mayor, for your leadership, Megan and Dan for always being here to help us make sure that we can get through these sessions easily and be able to answer the questions. And as Megan said, we will go through the questions that we weren't able to get to tonight and really post some of those. Sarah, I see that there's a couple in here that you've put. We'll get some additional information because as you talk about visits and numbers that are in there, that really depends upon the site and the different areas that we have in there. Finally, I just want to talk a little bit about next steps. As I said earlier, we are looking to offer and go out and find a consultant that's going to help us go to the next level, which will help us put together a variety of these plans, the opportunities that we have in order to move us forward on our journey as we continue to look at opening a supervised consumption site. That will include looking at and identifying sites. That will include doing community meetings. So people are able to comment on those, and we will publish those throughout as we always do within our public meetings. It will be posted on our website. We will also do a variety of other postings to get people the opportunity to really learn and listen. We're also going to just do some outreach to individuals in areas so that we make sure that we are open and transparent about the work that we're trying to move forward and work with our communities in order to save lives and move the supervised consumption site forward. I think most people realize that we don't have a sanctioned one or one in the United States as of yet. We know that people are watching Somerville, so we want to make sure that we're doing this right. We want to make sure that we are engaging. We want to make sure that we are meeting the needs of the clients, meeting the needs of our community, but also thinking for the future so that people will be able to have access to the services that they need to stay healthy and stay alive. So we want to thank you again for joining us tonight. Join us on as we move forward in future calls and in future town hall meetings, whether those be a virtual or in person. We want to thank you again for being here tonight. Melanie, TJ, Mayor, Megan, Dan, thank you for your time. Melanie, please share our thank you again with Michael when you talk to him again during your debrief. Again, thank you to all of you for taking the time out of your schedules tonight. Have a great night and please stay safe. And remember to drink a little extra water tonight. It's hot, it's humid out in our community. It's an important piece. So stay cool. Be well, everyone.
Thank you, Doug.